And 60% of Americans have chronic diseases, things like diabetes or chronic liver problems, Crohn's. These are things you could actually get ahead of with different behavior, nutrition.
Yeah. So we think about chronic diseases. When I was growing up, maybe the incidence in America was 6%, and now it's 60%, whether it's diabetes or COPD or heart disease. And a lot of these we think are exacerbated, caused by our diet, as well as the toxins we're exposed to our environment. Look, about 70% of your health outcomes are determined by you. It's determined by what you eat and what you're surrounded by. By the time you come to my office as a doctor, I can impact maybe 10 or 20% of your health outcomes.
Okay, so that is amazing. That is Senator Roger Marshall. And what I love about that video is it is a reminder that where a message comes from can really matter. Because if I said to you that a whole lot of your health outcomes can come from the decisions that you make in food or exercise or whatever, that is on some level true. Now, I might be missing crucial context of it's a lot harder for some people to eat the certain sorts of healthy foods that Senator Marshall might be advocating for you to do. It obviously costs a lot more money to eat that food. There are food deserts. Like, we could add all of this context, but I would just be saying, this is a thing that we can do. But he's a senator. He's not just some idiot on YouTube. So when he comes out and says, you know what? Almost all this health stuff, it's about the stuff that you do. That takes on a different meaning when you realize that he's part of a Republican Party that is going to try to massively cut spending on healthcare in terms of Medicaid, Medicare. For some people, even access to the food. They're gonna be cutting SNAP benefits. So on the one hand, he's saying, you all should really be responsible and eat healthier food. On the other hand, we're gonna cut tens of billions of dollars from nutrition assistance. Well, it makes it a lot harder. How the hell are you gonna get the fresh produce as a kid when your parents don't get the benefits that were barely keeping their heads above water before? And so again, what I think is important about the Marshall thing is we have this new version of like the Republican Party, where they want to rebrand themselves to appeal to the wellness influencers or whatever that got super into anti-vax stuff, and people like Joe Rogan that talk about health. And they want you to focus on that stuff. What they don't want you to realize is that what they're doing while you're focusing on your food intake is they're cutting the funding, they're deregulating the very companies that are pumping the foods full of things that they on some level would identify as being unhealthy for you. And they're not producing the regulations necessary and the funding necessary in health insurance for people to actually get the health care that they need. Even if you believe that 70% of it is up to choices about food or whatever, that still leaves a full third that is very much up to the stuff that happens at a doctor's office. And so there are those who think you should receive support for all of that. You should receive support and subsidizing both the food that you eat, exercise, making sure that these things that happen every day, the preventative healthcare is a thing that you have access to. They want to just wave their hands at the whole thing and say it's all on you. Pull yourself up by your health bootstraps or whatever. I personally think that you deserve support for that. But for the remainder, they also don't think that you need any support there. And so I identified a while ago, and I'll end on this. When they talk about like liberty, when it comes to, for instance, raw milk or whatever, I think raw milk is a really important example of the new RFK Jr. MAGA thing. They talk about the liberty, but you'll notice there's a couple different types of things you could do. You could come in and say, we've identified this stuff, the toxins, the processing or whatever, and we're gonna outlaw it. That would be a regulation on big business, okay? And that would anger big business, which is why I'm gonna say, mark my words, that's not the sort of thing that they're gonna be doing. Now, what you can also do is you can say, well, the regulations on the production of raw milk, we're gonna get rid of that. Okay, they would pitch that as a health thing. I don't think it's a health thing at all. The business is not gonna be mad about the fact that they no longer are regulated and they can do whatever they want when it comes to pasteurizing their dairy products. That's easy to do. You could do that any day. It doesn't anger the business. And so I want everyone to keep a scorecard when it comes to all this stuff with health and with food and all of that. What do they do when it comes to regulating the businesses that are making us sick? And what do they do when it comes to just freeing them up to do whatever they want, including make massive profits off of our backs? I have a feeling that there's gonna be a pretty massive imbalance between those two things, but remains to be seen. Maybe I'll be surprised. Thanks for watching our video. Did you know that you can support our show by becoming a subscriber? Just click the subscribe button and also ring the bell so that you get notifications when we're live or when we post new content.